everybody. Thanks for joining us once again for All Matters about Health and Wellness. I'm Dr. Kevin Usry. We're sponsored by All American Wellness, and thank you for joining us today.
I'm Heather Klein. I'm happy to be back. Great to see you again. So, Dr. Usry, let's get started. We should talk about today what we do in the facility. Besides car accidents, besides just musculoskeletal, what else do we do?
Well, we do a lot in regards to this triangle. We have a saying we're putting the pieces together of health so that you have health and wellness. These 6 issues are generally why people get sick. And our job is to address those issues, no matter what they are. Of course, we're chiropractors, so when you're a chiropractor, the foundation of your treatment is structure. So any biomechanical issues that people suffer with, we use the specialty of applied kinesiology to adjust and treat maladies that affect people's spine and their overall health to their nervous system.
Well, what's applied kinesiology? Let's back that up. Those are some big words.
Well, that's a specialty. As a matter of fact, I became an applied kinesiologist before I became a doctor. I think I took my first certification program in 1982, and in 1985, I was given my doctorate in chiropractic. And I've been utilizing that specialty ever since. And I'm going to need a little more time to just talk about applied kinesiology, but it's an additional tool that some of us chiropractors in this country use. Uh, Besides the standard diagnostic and diagnostic imaging tools that we use to arrive at a diagnosis, we use that extra tool of applied kinesiology. Some people have heard of it. They maybe have heard of muscle testing, but muscle testing is an intricate tool to give us a lot of answers to the questions of what is bothering the patient. Why is the patient having this particular symptom when others can't find the answer? That gives us a lot of insight to how the patient's neurological, biochemical, biomechanical, and bioenergetic function well, its status as to whether it's functioning well or whether it's not functioning well. So it gives us a lot of insight that I feel has added a valuable approach for us to be successful at what we do.
All right, we're definitely going to need a podcast about applied kinesiology. But going back to this, looking at our puzzle pieces. So you mentioned structure, and tell the people at home, what is electrical pollution? We hear those terms thrown around. What does it actually mean in terms of how we live our lives daily?
Well, the electron has changed our life for the most part for the better. It's given us all the music that we can appreciate. It's given us cell phones. It's given us our computers. But there is some downsides to electronics. Electronics can have a very powerful effect on the body. And in some ways, the powerful rays that come, for instance, from our phones can have detrimental effects on our cellular function. And at All American Wellness, we address that. We many times will give the patient a small device that they can put on their phone to stop all of that electrical pollution or those electromagnetic rays that can be disruptive on a cellular basis. It's a very small device, it's very inexpensive, and has powerful effects on the person, and in many cases stops a lot of the symptomatology that the patient comes in complaining of. They had no idea about electrical pollution, but it exists. And I'm going to touch on something we'll talk about in the future. It's affecting our children in a big way. Kids are getting cell phones now somewhere around between 10 and 15 years of age.
Sometimes
And
younger.
yeah, and those bodies are developing. That brain and nervous system is developing. That exposure to those electrical, magnetic rays can have a detrimental effect on some children. And all parents should bring their kids in if they're going to give them a cell phone to determine whether that's going to have a harmful effect. And, these cell phones are great devices. All you have to do is utilize them properly. Like anything that we have, you want to use it responsibly. You want to recognize the potential dangers. For instance, texting while you're driving, there's a potential danger there. Not realizing that the exposure to those electromagnetic rays without some kind of filter to prevent the cellular damage can be an irresponsible way to use a phone.
All right, so I think that definitely wraps up some electrical pollution. Also, computers.
Very much so.
And can the AC current from any lights, lamps, can that be affecting the body as well? Or are these things not as important to
I
worry
think
about?
they have a very, very ubiquitous effect on people. There's not a lot of strong electromagnetic rays that come from your lamp. Years ago, I remember in the 50s when we used to watch television, they would tell us, oh, back away from the television.
Mm-hmm.
Don't be so close to the television. Something's coming out of it. Um, I remember one time I used to work in the emergency room when I was 18, and I was working in the hospital in the emergency room. Some patient went down to heat something in the microwave. When it first came out, he was standing next to the microwave and he fell over dead. He had a pacemaker. The microwave completely disrupted his pacemaker. And luckily, he was right across from the emergency room. We brought him in. But nonetheless, ever since that day, there was a sign in front of the microwave. Please use your microwave carefully. Step away 3 feet. And that has been a subject that has become an urban legend, maybe, in regards to should you be standing next to your microwave? Well, certainly not. You know, you want to be away from that, especially if you have a pacemaker. So, all sorts of electric devices can have a detrimental effect if you're not careful.
All right, good. Something to think about for sure.
Oh, really? Absolutely.
All right, so going back to this, let's see. Allergies and sensitivities, that's a big one. You see everybody with allergies and sensitivities nowadays when it comes to anaphylaxis, peanut butter allergies, to just the smallest amount of sensitivities that'll make your face red. How do you like to handle those types of things?
Well, we use cytokine testing while we're doing the applied kinesiology, and it gives us great insight to whether a person is suffering from allergies. When that occurs, rather than going right to flora and fauna, outside issues, things with pollen and ragweed, we right away go to what foods they may be eating and consuming that are causing these problems with histamine reactions. And histamine is a neurotransmitter to the brain, and it's a stimulatory neurotransmitter. And when you have these histamine reactions, it can create changes in the brain function and changes in people's personality. Some of them, if it's not too serious, they get sleepy after they eat, or they feel so tired that they have to take a nap and they feel fatigue. But for some people, especially children, they get rather ramped up. They have uh, hyperactivity in the brain because of the neurotransmitter effects. And many times this leads to the diagnosis of ADHD, excuse me, and ADD. And this is, again, from dysfunction in the brain. It's not a disease. You need to look carefully at the person's diet to find out what they may be reactive to. In many cases, it leads us down another road to something called dysbiosis, problems that people have in their gut that they're not aware of. And these microorganisms don't need to be there. They're causing detrimental effects. Many of the public knows about eating probiotics, eating foods that are fermented because they seem to encourage the growth of good bacterium that the body definitely needs to perform many of its biochemical functions. But when you have these microbes that are detrimental to the function, it can affect the brain in a big way. The amount of research that's been done in the scientific community between gut health and brain health is extraordinary in regards to the amount and the connections between how brain dysfunction can be caused by simple issues in the gut. Many autoimmune problems can be caused by problems in the gut that patients are often not aware of, or they do the worst thing they could possibly do. They rationalize it. Where would we be without a good rationalization every day, right? So they rationalize and rationalize why they have these issues to the point where when they come into our office, we're not the first place people think of, oh yes, my GI system isn't working right. I need to go see the chiropractor. That's not the first place that they go to. And by the time they come to us, they're disappointed and frustrated. They've been to the medical field, and thank God they didn't get their money's worth. They don't have disease and pathology. They have a dysfunction. And once we show them what they can do about eradicating these symptoms that seem to be plaguing them, they're delighted to know, they're relieved to know that, wow, so it's not disease. No, your medical doctor didn't find disease and pathology, and they're excellent in that area. If they didn't find something, go out of that office and celebrate. You may be frustrated not knowing what's causing it, but you can be sure it's not a problem that's going to ultimately kill you.
Well, it's definitely good. And how do you go about combating that? Once you see that food toxicity or the food sensitivity in these patients, do you use a combination of nutrition? Do you also go back to now your muscle testing? How do you tend to typically handle those types of issues?
Well, we do use applied kinesiology to determine what the person may be reactive to. For a lot of people, I would say maybe 90% of the people I run into are having issues with allergies. It's coffee. It's not only caffeine, it's something called paraxanthine, theophylline, theobromide. These four chemicals have a very large impact on the body's biochemical function and can cause allergies, all sorts of disruption to the function of the stomach, the small intestine, large intestine, and it can impact people greatly in their lifestyle. So, identifying what you need to stay away from, identifying why you need to stay away from it, coming up with herbs. We also use laser therapies to help heal the gut. So, between the combination of these herbal remedies and laser therapies, patients are finding a lot of turnaround in a matter of maybe 2 weeks, where they can once again start enjoying the foods that we had initially take them off of, and they can start enjoying their life as a healthy person once again.
Great. Well, I'm happy we addressed most of the pieces in the puzzle. I can't wait to get more in depth with the rest of them. Perhaps our next podcast, when we're not talking about applied kinesiology, or when we decide, to get right down into the nitty gritty.
Yes, I would like that very, very much. Thank you.
Thanks for spending time with me. Thanks for spending time with us.
Yes, thank you very much.
And
We look
remember,
forward to you next week.
well, tell them where they can see us.
You can see us on Spotify, we're on YouTube, and we're on Apple. So look for us once a week, all about health and wellness. This is Dr. Usry. Please give us a call. We were sponsored by All American Wellness Center. Let them know that you want to make that free 15-minute evaluation at 561-863-8779. You'll speak to Heather Klein, or go online at allamericanwellness.com. You can make an appointment right on the computer. We'll look forward to seeing you. Bye-bye now.
Have a great one.